Improving occupational health in the office. An on-site hazard evaluation was performed at the University of New England's online programs office. Following this, a hazard analysis report was constructed. The purpose of this presentation is to summarize the main hazards found and to provide recommendations for improving the health and safety of the employees in the worksite. Occupational health is tasked with protecting the health and safety of workers by identifying, monitoring, and preventing work-related injuries, illnesses, and hazardous exposures. During this evaluation, employees were observed during a typical workday. Measurements for temperature, humidity, noise level, and lighting were taken, and one employee was interviewed as part of the job content questionnaire portion to assess psychosocial stress and strain in the workplace. The most significant hazard to the employees of this office is the potential for musculoskeletal disorders. MSDs are groups of injuries that affect the body by way of muscles, tendons, nerves, discs, or blood vessels, and risk factors for MSDs include repetitive motion and repetitive or sustained awkward postures. Carpal tunnel syndrome has occurred in the office previously and is at risk to workers here. For awkward posture, working with the neck bent more than 45 degrees was one of the postures noted during the observation. This could be by just looking at the computer screen or by popping the phone between the shoulder and the ear, and also working with the back bent forward more than 30 degrees. For gripping, we noted gripping an unsupported object weighing 10 pounds or more, or with a force of 10 pounds or more, to be using the mouse, and highly repetitive motion, intensive keying was observed. Exposures and psychosocial strain portion. The temperature is slightly above average at 25.5 degrees Celsius. Mold is mentioned to be present in the bathroom. The HVAC system comes on sporadically, which causes a draft pointed at workers from behind. The aisles are very compact and cluttered, posing a high risk for tripping, and the workstations provide little privacy, which can make concentrating difficult. For psychosocial strain, the JCQ algorithm asked a series of 14 questions related to job skill, decision authority, and demand, and Cynthia scored above the national average in most areas, but her score was slightly below average for psychosocial job demands. Improving the worksite. Here are recommendations. Ergonomics is the key to preventing injuries in the worksite. Ergonomics is the study of people at work. Based on this picture, you can see that the hands and wrists should be in line with the elbows. The back and neck should always be in an upright position, whether sitting or standing, and the feet should be flat on the ground. The head location in relation to the screen should be comfortably at a slight downward angle rather than directly horizontal, and the head to screen length should be appropriate to reduce eye strain. The goal of ergonomics is to prevent injuries and illnesses in the worksite associated with overuse of muscles, incorrect posture, and repetitive activities. And this is the key to preventing most of the injuries in this office. You can improve health and safety here by raising awareness about this correct desk posture, take regular stretching breaks, possibly once an hour, encourage employees to remain at home when they are experiencing respiratory or gastrointestinal symptoms, and measure employee happiness through a yearly satisfaction survey. A safety committee would be the best way of doing all these. Forming a safety committee would improve the health and safety of the worksite. Employees can express their concerns regarding safety matters, and new safety information can be passed along to employees through this committee. Ergonomic training sessions would be a plus. They would educate employees about the ergonomically correct way to sit at a desk, whether sitting or standing actually. A study by Mahmoud et al. Found a significant improvement in computer workstation habits following a cluster randomized trial of ergonomic training sessions versus pamphlets. Large improvements were noted in body posture and position of keyboards, elbows, wrists while typing. Psychosocial strain. Perform regular employee satisfaction surveys to find areas for improvement. Have employee meetings with the safety committee to discuss issues, and encourage employees to seek help for any symptoms. Final thoughts. The most significant hazard the employees face in this office is the risk for musculoskeletal injuries, especially carpal tunnel syndrome, and the best way would be for the university to develop a safety committee that can educate the employees, listen to concerns, and monitor the workplace hazards. Thank you.